We are continuing to manage the impact COVID is having on all of our lives. Vaccines have proven to be a safe and effective way of protecting us from the worst outcomes of this virus, and Ireland's high vaccination uptake, along with the efforts we have all made to follow the public health advice, mean that the last mandatory public health measures have now been removed. Of course, as we move to this next phase, there are many who will be anxious, and it's important that we maintain our focus on protecting ourselves and each other. The public health advice remains that you should continue to wear a mask anywhere that you feel that this is appropriate, but particularly on public transport and in healthcare settings. And be aware that many people will choose to continue to practice physical distancing and avoid crowded settings over the coming weeks. Continued adherence to basic hand and respiratory hygiene and ensuring good ventilation remains important to stop the spread of COVID and other respiratory infections. Everyone who has symptoms of COVID should isolate immediately and should stay away from others until 48 hours after their symptoms have substantially or fully resolved. It's no longer necessary for everyone with symptoms to get tested. However, you should book a PCR test through the HSE portal if you're aged 55 years and older and have not received a booster, or if you have a high-risk medical condition, or if you're immunocompromised, or if you live in the same household or provide care or support for a person who is immunocompromised, or if you're pregnant, or if you're a healthcare worker. Close contacts who have no symptoms no longer need to take a test or restrict their movements. However, they should still self-isolate immediately if they develop any symptoms. As we move into this new phase, we are in a broadly positive position. This morning, there were 47 patients with COVID in critical care. While we all want that number to continue to fall, it is the lowest number in critical care with COVID since last August. However, about 60% of those in ICU have not received a booster dose, which emphasises the need for everyone to take the opportunity to get vaccinated. Vaccines are available to all those aged 5 and over, and booster doses are available to everyone aged 12 years and older. If you or your child are yet to receive a primary or booster dose of COVID-19 vaccine, please book an appointment on www.hse.ie as soon as possible. Thank you.